Good evening, ladies and gentlemen. My name is Maria Luna. As you know, for over 20 years, I've been the host of a program called Dialogo Democrático, Democratic Dialogue. It means that I made a promise a long time ago that if I had the opportunity to reach out to people in my community, to bring education programs, to get information to our communities about the issues that are extremely important to our daily life, I will do so. Many years I had this program with Dr. Rafael Antigua, a very well-known doctor in our communities, and also international star of the medical system. We have today one guest that I am very proud of to know her and to also discuss those important issues about health for all of us. Let me just tell you a little bit about the program. Manhattan Neighborhood Network is a public access television where they give opportunities to people like me to do the same thing that I just said, bring information. They do a lot of stuff. I mean, if you go in to the different channels, you will see the diversity of the programs that they do. But I have I was lucky to get them to allow me to do this, and I do the show in both languages, English and Spanish. This year, we had the misfortune of having a terrible crisis, a pandemic. COVID-19 hit not only us here, but around the world. One of the issues that we're going to be addressing today has something to do of the consequences of what we are suffering right now. So bear with us, and I'm telling you, I promise you that we're going to have a very nice, interesting program. Mi nombre es María Luna y le traigo este programa Diálogo Democrático. Como ustedes saben, por muchos años comencé con el doctor La Antigua, trayendo información, educación a nuestras comunidades acerca de los temas salud, educación, vivienda. Todos esos temas que son críticos para la vida de todos nosotros, especialmente personas que venimos de otros países y que nos encontramos con una realidad totalmente diferente a la que nosotros estamos acostumbrados. Pero hoy tengo el honor y el orgullo de tener como mi invitada especial un producto de nuestra comunidad, porque aunque ella no nació aquí en Washington Heights, está trabajando en una de las mejores instituciones médicas que nosotros tenemos, Columbia University and New York Presbyterian Hospital. Yo le voy a leer dentro de un momentito el bio de ella y verán que es una gran mujer y doctor. I would like to add that my guest today is someone that is also have a goal of bringing services, health services to everybody in our community, the young, the middle-aged, the elderly. She doesn't care. She's just a terrific doctor, a medical doctor. There's a lot of doctors out there. But anyway, Dr. Mara Minguez is a person, and I have to read this in because this is just incredible what I'm going to read for you. Dr. Mara Minguez is an assistant clinical professor of pediatrics at Columbia Public Health and Mailman School of Public Health. Dr. Minguez is a board certified in adolescent medicine and has spent most of her career involved with New York Presbyterian Hospital, school-based centers. She was the first medical director of the highly successful Land Use Medical School. And at the end, we're going to speak briefly about that. This program, and among her many roles, advises the community affairs team at New York Presbyterian in her capacity as Assistant Chief Medical Officer for Community. Not only that, she is a woman. So I am so proud to read this bio and about her professional life. So Dr. Minguez, I am glad to see you. I have tried for a long time to get you to my program. If it's no one thing, it's the other. You are very involved. So thank you, thank you, thank you. Muchas gracias por estar con nosotros hoy. So I would like to ask audience to pay attention, because this information, you just don't get it on newspapers and things like that. And we are giving you, we're going to have a treat. Not only we're going to have a doctor that is an expert on this particular system that we have, but also we are having a video, very short video later on, where we can fill in all the questions that you may have. Dr. Minguez, the floor is yours. And once again, gracias por estar con nosotros.
Muchas gracias, Maria. Thank you, everyone. It's an honor to be part of this and a part of the mission to educate our community. And something that you missed, two things. I have been serving the community for almost 20 years, and also I am of Dominican descent, an immigrant as well. So those are my most important attributes. Aside from being a doctor, that defines exactly who I am. Gracias, María, por todo y por su invitación a esta misión de educar a nuestra comunidad. Y dos cositas que se le olvidó mencionar que son muy importantes y describen quién soy y de dónde vengo. Es que sí he practicado aquí en la comunidad por aproximadamente 20 años y que también soy de descendencia dominicana. Y eso es quien soy y necesito mencionarlo. Hoy estoy aquí para hablar sobre la telemedicina, un tema muy importante en estos meses, ya que es una de las únicas maneras que podemos tener acceso a algún proveedor médico. Así que es muy importante que la comunidad esté al tanto de este sistema. It is a pleasure to be here and talk about telemedicine. Telemedicine has ramped up tremendously in the last months due to the pandemic, like you mentioned. We've had to adapt, and our hospital has been amazing at really being at the forefront of that adaptation process and to pivot our care to a virtual platform. And we had no choice, right? At one point, we were all at home, so we had to ensure that we could provide access to every one of you out there. And right now, I want to show you, before we start the conversation, a video that is a nice summary of what is it and how you can be a part of that process and how you can actually really understand how the visit goes when you are talking to a medical provider. Quiero mencionarle, antes de empezar nuestra conversación con María aquí acerca de la telemedicina, que le voy a presentar un pequeño video que es un resumen de lo que es la telemedicina y alguna le va a contestar algunas preguntas que seguro usted tiene. Así que, let's just show the video. If anyone can just play it, that would be wonderful.
Hello, I'm Mara Minguez. I'm a doctor at New York Presbyterian Hospital, and for the last 13 years, I've been practicing at one of our school-based health centers. Within our community practice, we've always been looking for ways to improve patient experience and comprehensively address their needs. Health and well-being is more than what happens in the exam room, and telemedicine allows us to step outside of our practice walls and improve access to care. It's fast, easy, and anyone can do it. A video visit is a lot like other appointments with a world-class NYPH provider.
Hello, Ms. Anderson. How are you?
Hi, good to see you.
Nice to see you too. How can I help you today?
Wanted to speak to you because the last couple of days I've been dealing with a really bad headache.
You'll discuss your medical history and the reason for your visit. Your provider will share an assessment, check in on chronic conditions, and answer any questions you may have. If you need any prescriptions or refills, your provider will take care of that, and you'll receive instructions on follow-up care.
And I feel like it's been like traveling down to the side of my ear.
Of course, you won't be in the same place as your provider, and you don't have to travel to see them. With a video visit, you won't have to sit in a wait room or take time off of your daily responsibilities for the appointment. You also won't have to travel to and from the doctor's office or rely on public transit or someone else to get you there. Video visits are a wonderful way to communicate with your provider, and there's a lot they can do for you remotely while keeping you in the comfort of your home. I know what a benefit that convenience and ease of access will be for our patients. When you're under the weather, we know that you want to get care fast, and getting to your own doctor's office can be a hassle. Telemedicine keeps you rested at home and gets you talking to your doctor sooner. For our patients with chronic conditions, we know that routine follow-up care can be an onerous routine. Telemedicine makes ongoing care a more seamless part of your day-to-day. For our new parents and pediatric patients, we know that questions and concerns are a part of daily life. Telemedicine gets you peace of mind in record time. And for those patients who may want or need someone to support them during a televisit, telemedicine makes it easier to have your loved ones fit that support into their schedules. We're excited to give you time back to focus on your health and well-being. At New York Presbyterian, we're leaders in telemedicine, and with over 500,000 virtual encounters and counting, we've seen the benefit telemedicine has brought to our patients. I've been grateful to have meaningful digital touchpoints with my patients at the moments that count. And hearing how happy they've been with their video visit has been incredibly rewarding. I know you may have some questions about what telemedicine means for our patients and families.
Does this mean patients won't have visits with their providers anymore?
Not at all. Video visits are part of the continuum of care. In fact, with messaging features and other tools, you'll have easier access to your care team.
Will patients receive the same quality of care?
Absolutely. There's a lot that we can do and see without having to be in the office. Not all visits need labs or testing. And if you end up needing them, your provider can direct you to the right steps. The full care team is available virtually too. Video visits can connect you with dietitians, social workers, and care coordinators, to name a few.
Will patient information be safe and secure?
Of course, video visits take place through our secure patient portal.
How will patients be able to navigate the technology?
Actually quite easy, and I can walk you through how. You'll set up your account within our patient portal called Connect, which you can access through the NYP or MyChart app. With Connect, you can organize your medical care, communicate with your provider, and request appointments, and more. It puts your healthcare information right at your fingertips. Your video visit also happens within Connect and can be completed on a smartphone, tablet, or even a computer if it has a web camera. On the day of your visit, you'll select your appointment and complete a few forms, just like an office visit. Once you're ready, you'll click to begin your visit, and within few moments, you will be connected to your provider. Patient technical support is readily available at every stage of the process, and support is available in multiple languages.
To learn more and get connected, head to nyp.org/video visit.
Wow, that is really,
Kansas.
this was a really great, informative, short, and answered most of our questions. But anyway, I do have questions, of course. Now, before I do that, could you do me a favor? Could you just do a little summary in Spanish about what you just presented to us?
Absolutely. Okay. Quiero mencionarles un poco sobre lo que vieron en este video y también mencionarles que el video está disponible a través de la website que les enseñamos en español, con toda la información también en español. Pero para mencionarles de qué se trata el video es, número uno, explicarle la importancia de la telemedicina. La telemedicina es un modelo de salud médica que en realidad creció mucho durante el COVID y se va a quedar de por vida. Esto no va para ningún lado, así que es muy importante que todos tengamos la oportunidad de entender el sistema y sentirnos cómodos. Una cosa también que lo hablé en el video es de qué hacer, de qué tipo de visitas son importantes para uno entender el sistema. Y también contesté algunas preguntas que podemos hablar más en más detalle acerca de estas preguntas que tienen las personas de la calidad de esa visita. y estoy muy dispuesta a hablar sobre eso en detalle y explicarles sobre mi propia experiencia en la telemedicina. Y lo último que hablamos en el video es el componente de cuando está ya listo para hacerlo, cómo se hace. Y eso también lo podemos hablar más en detalle. No es difícil, se aparenta y es mucha información, pero podemos hablar sobre todo esto poco a poco ahora.
Okay, so let's say that a doctor calls, we have an appointment with a doctor, you call, and how about the privacy of this type of, interaction between the doctor on this media and the patient?
Very, very good question, because it's something that we cherish and we teach in terms of what needs to happen in a medical encounter. We need to feel safe. We need to feel like we have a safe space to let someone that we may or may not know tell them everything about our symptoms and our body. So I appreciate the question. So there are models, and basically every single one of these telehealth platforms are HIPAA regulated, which means that we still have to abide by the privacy regulations of an encounter with the patient. Entonces le quería mencionar una buena pregunta, María, en términos de la privacidad, ya que es algo muy importante para nosotros cuando vemos a un doctor, de sentirnos cómodos con esa interacción. Y toda la plataforma que se ha desarrollado para hacer telemedicina también tienen que asegurarse a través de la póliza de HIPAA que tiene que ver con la confidencialidad del paciente.
Sí, porque sabemos que pacientes, personas viven con familiares, home attendant, y esta es una cosa que siempre es muy delicada. It's really extremely important to keep that privacy. Another thing is, how about the medicine? Like the doctors will be able to assess the patient and then do whatever prescriptions and information about the care and things like that. Is that done directly with the patient, right? And that is also the pharmacy, you get involved also with the pharmacy and things like that.
Yes, absolutely. So, and I want to give you, you just brought up a good point of what happens in that encounter. And one thing that I want to mention and step back in terms of the privacy when you live with a lot of people. So when I have an encounter with a patient, and usually adolescents, and I want them to feel comfortable with me, I ask them, are you in a space where I can ask you questions that are confidential and maybe kind of difficult if there's someone around you? And at times I have to say, hey, just go like this, yes or no, because I want to make sure that I can adapt my questioning to your surrounding. Algo que quería mencionar es que yo como doctora, cuando veo pacientes, sí les pregunto a ellos, están en un lugar donde se sienten bien y le puedo hacer preguntas que son privadas, y si me dicen que sí, entonces sigo adelante con las preguntas. Entonces, lo otro que mencionó es, María, habló de la interacción, ¿verdad? De cómo la persona habla con el doctor y cómo es esa interacción. De verdad que se siente muy, muy similar a hablar. Esto puede ser, algunos de ustedes van a decir, no lo puedo creer, pero sí se siente similar, porque en realidad la literatura enseña que el 90% de un diagnóstico está en la información que se habla, en la historia. Así que sí se siente igual, y también podemos a través del sistema mandarle una receta. Muy fácil, lo puedo hacer muy, muy fácil. Y es muy bueno también, le quería mencionar que he tenido la oportunidad de decirle a un paciente, déjeme ver qué más usted está tomando, póngamelo ahí, enséñeme, vaya al botiquín y enséñeme. Y eso es algo que no lo puedo hacer cuando están en mi oficina. So I wanted to mention some of the pluses and the importance of what I found have been a plus in telehealth, and that is that I am able to really talk to the patient and listen, because this is all we got, right? And listen, and also ask them questions around what their medications, and say, hey, let me see what you're taking. Why don't you go and find all the medications and show me? So that's important. And if they need anything, a refill, I can just automatically just do it via the system, and then they can pick it up in a couple of hours.
Okay, so that means sounds great, but sometimes we need to see a doctor in person.
Yes.
Now, how do you bypass this telemedicine system to get an appointment and to, or whatever emergency that we may have, that it doesn't have to wait like for 2 or 3 months for the next scheduled, visit?
And that's a great question because of the situation with the pandemic. So I do have to mention that it is important for everyone out there to understand that this does not take away your interaction with your doctors, right? This supplements. It doesn't mean that you're never going to see your doctor again. So please understand, because that is very important. And it also, I want to let you all know that if you need to come to our offices, we're ready for you. We have an incredibly safe environment, and we're ready to see you. So this doesn't take away that aspect. So if you need to see someone for any reason, you call the system. At this time, a lot of physicians are actually having a conversation in telehealth just to assess if we should have you come to our office or not. So you may have the two components together, okay? And we just ask the questions. And that is done, Maria, to make sure that patients are not waiting too long in our offices. So if I can ask you all the questions via telehealth, when you come in, you can just do quick, let's do the exam, and you're out. So that's why we can do both. And
Well,
muy important. Go ahead.
No, I'm gonna do what Maria Luna usually does. That comes up with crazy, stories. But we are going to be missing also the interaction that when we go and see the doctor, we wait in the waiting room and we hear stories, and then that also takes a little bit away from visiting a doctor, because not only with the people that we are, sometimes there are people who goes to see a doctor with a headache, but for what they hear from other patients, they come out of there with a stomach ache, and then they have all of crazy illnesses that they never had, and they never, and that is something that I say to my daughter sometimes. I said, you won't believe the stories that you hear on those. Le estoy diciendo principalmente porque somos latinos, cuando vamos a visitar a una cita y tenemos muchas personas alrededor, de ahí salimos con cantidad no solamente de enfermedades, también tenemos cantidad de remedios. Le dicen, no te lleves del médico en la pastilla, tómate este té de lo que sea. So I think it's a social, we're going to be missing that little social component of the going to see the doctor.
That is so, Maria. There is a social component that's key, because usually if you follow up, you might see that person again.
Sure. No,
Two more weeks or 4. So there's a social component that it's not there fully. But remember, you get to make the call from your own couch, which it's pretty nice too.
Right. No, I believe that because of what we're seeing now, this is quick also. There's something that is less stressful. We're going to the doctor, my blood pressure goes up, and come home, my blood pressure is normal, and that, that type of thing. And it happens to a lot of people. A lot of people get really stressed because they going to the doctor. What are they going to find? Not only what the problem that I'm going to be discussing with the doctor, but also all the things that comes to mind. And it's part of psychology. I think that for us as human beings, we don't want to hear bad news, but I mean, that's a factor of having a visit with doctor. I have nothing against what you are presenting, but I think that you have to be a little careful about something like that.
Yeah, y nos va a tomar tiempo acostumbrarnos a este nuevo modelo. And it is going to take us time, which is absolutely something. Even as a physician, I'm a person that likes to hug and be close and really feel that presence. So it has taken me some time also to adapt to this new model.
So this is really something to do with the COVID, a question about the COVID. Are we really prepared to deal? This is going to continue for a long time. How do you see the future, the medical system, and with the telemedicine?
Absolutely. So this is a great question, because telemedicine is going to be that link to continuing healthcare. We, as you know, many of our people were affected specifically here in the New York area. And what I want, right, through this platform, through you, which thank you so much, is to really involve every single one of you out there to find out about telehealth. Call your doctor and find out, how do I get involved? Because if we go to a second surge, Maria, I want to prepare all our audience and the patients to empower themselves to use this service. Otherwise, they just don't come. And we need to be prepared. I think we're ready, and we're going to use telehealth in case people are at home. We're prepared. I think we just need to make sure everyone's educated.
So this telemedicine, how, let me see, I just have the word in my head, but I forgot. How popular is this system, already is, or how are you going to really go into our communities and inform the communities that this is available and that we should follow, or at least giving it, giving the time to, a testing time to go into that and see if it's really good for some patients and some it may not be good for other patients.
That's true. So how popular is key. So because of the restrictions and CDC policies in a medical office, right, and they can't see that many people at once, we have most physicians in the entire nation are now pivoting and seeing more patients through telehealth than in person. And that's just as a consequence of keeping everyone safe and making sure that we abide by the policy. So it has become really popular and as a need, right? So that's something that we have no control of. And I missed out, Maria, was the second part of that question that you had?
I forgot. No. My question is that how are we going to be able to educate the people to make sure that they really trust the system and that it is safe, and that are also connecting people that may not be able to have either. Some people don't even have telephones; they depend on other people's telephone and things like that. Mm. Do you do that only by telephone, or do you do that using the internet, the iPad or anything like that?
So any device that has a camera, you can actually have that interaction. So any device that has a camera, you can have a televideo visit, a video visit, what we call. So they just need to have a camera so that we can see you. And there's a lot we can do, by the way, in being able to see you. And just to answer the question about how do we educate? So one of the things that I've taken on is going out there and doing just this, going to community board meetings, going to meetings with different community-based organizations, talking to youth, the elderly, every population, and say, hey, it doesn't matter who your doctor is. I'm here to tell you about telehealth and the importance of knowing and educating yourself about it so that you're empowered to access care if a second surge comes. I want you to be prepared. So I am going out there as much as I can.
Okay. Many years ago, when we started having the clinics, the ambulatory care clinics, New York Presbyterian Hospital, I am part of one of their advisory boards, yes, put together some literature, little flyers, a little pancards, and that type of thing that was distributed to the people so they could have it handy in case sometimes you need to call a doctor and you cannot find that information. But if you can have that little pancard in one place in the house, you have more access to the system instead of waiting for someone from the hospital to set an appointment and things like that. Is that something that you're just relying on online information and things like that, but there are some people who don't live with a telephone in their hands or sitting in front of a iPad or a computer. So we need to reach out to that. And also we went as far as going to supermarkets and bodegas and ask them to insert those little pan card into the bag, the people who will, purchase food and whatever, and they will come out of there with that type of information. So maybe something like that should be looking into.
Hi, Maria, and I love it. Thank you so much, because this is part of what we also get from these conversations is what works for the community. And I think that's a great marketing strategy, and I'm going to take notes. I appreciate the ideas.
All right, so that's fantastic. Let me see. How many more questions? I have a whole bunch of questions here that I don't want to scare you.
No,
but that, something, I don't like injections. So that means that by talking to the doctor on the telephone, I know he's not going to, to give me a shot or something. So.
But Maria, I want you to come and get the flu shot.
No, I already did. That's one of my little closing statements at the end. What else can you tell me about, the telemedicine that we haven't covered? Then I will ask you about something else different.
Of course. So I wanted just to mention some of the key components. If you set up a visit, what are the key components for you to have a very productive encounter with your doctor? Number one, always make sure that you're in a space, like you mentioned, that's private, okay? And just set yourself up beforehand. Also make sure you have good connectivity and it's a space that it's not freezing the video or anything like that. And get ready with questions. Write them down for your provider. There's a lot that we can do in conversing with you. Be also ready to be comfortable, because sometimes I myself ask them, stand up, do this, do that. I make them do a lot of things so that I can see them. I can even see how they're breathing, how they're talking, so I can get a lot from the conversation and seeing them. And also be ready just to jot down and say to your provider, hold on, I need to write something down. We're here for you, and we just want to make sure that you get the care that you deserve.
Now, when I read part of your bio, something that is really, that I love about our community institutions. I am biased for New York Presbyterian Hospital, and some people accuse me, you love the hospital too much. The hospital provided some services to my family that will always appreciate, even though my older sister died there for whatever illnesses that she had. My mother passed away. She was treated for years and years at Presbyterian Hospital. My sister and myself, but there is a special program that New York Presbyterian Hospital have, and you were instrumental in that. It's the LAM program. Could you tell us a little bit about it?
Absolutely, I'll be delighted. So the Lang Youth Medical Program is a 6-year medical pipeline program. And yes, you heard right, it's 6 years, so it's a long. We actually recruit kids. Actually, before I do that, the mission of the program is to really diversify healthcare and provide kids who are in our community who really want to learn about the healthcare system, provide them and foster them with that ability to get involved early on, starting in 7th grade, from 7th grade to 12th grade. So they're able to do a lot in our hospital. They're able to come in, do internships. They pretty much grow up in front of us, which is really dear to my heart. And as someone who came in to this country, I was 12, not knowing English and wanting to be a doctor from the beginning, it is an honor to be a part of this process for them, because I myself didn't have anyone in my family who was a physician and could really walk me through the steps of how to become one. So it is an incredible program. We've been in existence for 17 years. We have now about 6-7 alumni that are working in the hospital, NICU nurse, actually several nurses, ER. We have administration as well. And we're very proud of what we've done. And it's a way to tell the community we're not just here for patients, we are here for the youth, we're here for every stage of life.
Great. En español. You have to tell us that.
Sí, no, perfecto. María me acabo de preguntar, soy la directora médica del programa de LANG, y me acabo de preguntar que le mencione a ustedes, le describa qué es este programa. Este programa es un programa que ya tiene 17 años y fue desarrollado para los estudiantes en la comunidad, específicamente Distrito 6 escolar. y ellos vienen a nuestro hospital para aprender cómo involucrarse en el sistema médico aquí en Estados Unidos. Y específicamente todos los que quizás no hubiesen tenido esa oportunidad. Y también le mencioné que ellos hacen muchísimas internships, tenemos niños de 9º que también han podido estar en la sala de operaciones, los exponemos a cosas que quizás no hubiesen estado expuestos si no hubiesen sido parte del programa. Y ahora tenemos aproximadamente 7 o 8 que se graduaron del programa y ahora son enfermeras o están en administración. Pero la pregunta.
Yeah, this is going to probably be the final. No, that's not going to be the final. But how can the students, the young people, apply for this program? If it's free, it's a you know, all that.
Yes, great question. So the program is free. A requirement is for the child to live and go to one of the public schools in District 6. And that's important because the philanthropists who started it at that time and our institution, the mission was to make sure that those who work inside the 4 walls of the hospital also look like the ones that are outside. And that was the main purpose. So they need to be 6th grade, District 6, and interested in being part of the medical field.
That is fantastic. I remember Mr. Lan and Dr. Pardes who,
yes,
started that program. So now, am I going to give you a little break? No.
That's okay. I'm ready for anything else.
The last part we didn't say in Spanish about the program being free and did you say that in Spanish?
No.
Okay. So are they, you forgot to say, or maybe, about the students that are within our, catchment area.
Okay.
And the requirements. So if you just touch that in Spanish.
Okay. El programa LAN es gratis. El requisito es ser un estudiante del Distrito 6 escolar y tener el interés en ser parte de alguna rama de la medicina.
Well, many years ago, no, I think from the beginning, I've been attending the graduation, which is so much interesting to see the parents being so proud of their children that they had the hope that maybe the parents did, couldn't reach that dream, and that this is a free opportunity to those that are, into that line, that line of service. Because if you are a doctor, you're a nurse, you're a dentist, you are providing a service because you care, because this is within you. It's not like, let me just take this, this course because I can get a job doing this thing and then, live like that. But this is a dream for so many parents to have. We have one of our neighbors that she's sacrificing. She's a cleaning lady. She cleans apartments 7 days a week. Her daughter is now involved in Binghamton,
nice.
Into the second year, the first year, second year. And she is, she just ring that her daughter, Michelle, will become a doctor eventually. And she just leave because she said that she wanted to be a nurse, but her daughter wanted to be a doctor. So she is trying to make sure that, she reached that dream. And people like that, when they have the opportunity of having their children, being educated and led to the path that they wanted to reach, that is really fantastic. And I always said to Dr. Pardes, and Mr. Lang, when I met him years ago, he was so proud to see, what was happening about also that the dream. And we have to remember also that he wasn't a Hispanic, he wasn't an African American, he was a white person, seeing the needs in our community, having the means to provide for those that are, that really need it. The man is a hero. I'm telling you, in my books, he is a hero. And one day maybe we will invite some of the students or the graduates to the programs, so people, so they can speak about their experiences. That's important, because then they reach out to other young people, and that they may, do the same thing in their life. Let me see. Oh, I don't want to abuse your time. This has been a fantastic program. I think we have a few minutes, and let me just do a little housekeeping. As you all know, we are living in difficult times in our nation, in our cities, our neighborhood. We've been not only impacted by the COVID-19, but because of the economics, the politics, and the lack of humanity that some people in leadership positions have. They don't understand that this is a word that we need to include everybody equally. It's not a word for the very rich, because the very poor also are entitled to have a decent living, and they have opportunities. I am urging people to register to vote. October 9th is the last day that you can register in order to participate on the general elections in November 3rd. I wish people take advantage of also opportunities to vote early. There are going to be 10 days before November 3rd that people can go to different areas and vote. They don't have to wait for election day. It's another opportunity. The people can fill out an absentee ballot that gives the opportunity to ask for a ballot by mail. You can fill it out, vote, send it back. It's only cost 50 cents a forever stamp. In our communities, we are going to have, and of course, if you know someone that wants to vote in person, make sure that that you accompany that person, that you say to someone, I'm going to help you to get to reach to the ballot place, to make sure that we elect the right person. I'm not going to mention who I'm supporting because I think it's obvious. But anyway, I want to make sure that the people in our communities knows that the early voters starts October 24 through November 1st. And it's going to be at the 1150 San Nicolas Avenue at the Columbia University Roseberry Medical Science Center, the corner of 168th Street. The polls are open early in the morning until there are different times. Make sure you vote. Yo le estoy pidiendo a las personas que vivimos aquí en este país que tenemos la oportunidad de tener una diferencia. Tenemos sueños y todos debemos tener la misma oportunidad. Ricos, pobres, quien sea, debemos votar. Quizás para un cambio que sería necesario, porque necesitamos tener en posiciones de liderazgo personas que sean sensitivas, que entiendan las necesidades de todo el mundo por igual. Y hay formas de hacerlo. Registrándose para votar, el último día es octubre 9. Tenemos absentee ballot, como se llama, que es el voto ausente. Se puede pedir una aplicación y se le manda la boleta. La gente nada más tiene que ponerle un sellito de un forever, 50 centavos cuesta. Eso es barato para un voto, ¿verdad? Además, hay 10 días antes de noviembre 3 que se puede votar, desde octubre 24 a noviembre 1. Salgan a votar, es imperativamente importante hacerlo. Yo quiero darle las gracias a la doctora Mara Minguez por ser no solamente una doctora, por darnos esta oportunidad de educarnos, de hacernos tener confianza en el sistema médico, porque muchas veces tenemos deficiencias, decimos, no quiero decir, yo me puedo curar solo, no se puede hacer eso. Tenemos que respetar personas como ella, una mujer joven, una persona que se le ve la dedicación a su medicina. I am so proud of you. I am also thankful to the New York Presbyterian Hospital and Columbia University because she is a star, and keep her there. Don't let her go any place. Also, thank you, Manhattan neighborhood, for giving me the opportunity once again to bring in my Dialogo Democrático to your homes. The program is going to be shown Wednesday, October 7th, from 7 to 8 p.m. and the channel is 67. 67 is a local channel, covers the entire Manhattan area and part of the Bronx. So please tune in. My next show, fortunately, is going to be November 4th. No, yeah, right after the election. Bye.